The bottle in your medicine cabinet that you've been trusting twice a day for the last decade may actually be undermining the very oral health it promises to protect. That's not a hot take from some fringe corner of the internet. That's the direction a growing body of peer-reviewed research has been pointing for years now. And it's the reason the Canadian Dental Association has quietly softened its language around alcohol-based mouthwashes over the last several update cycles. We grew up watching commercials where a stern actor swirled blue liquid in their cheeks, winced through the burn, and emerged with a smile so white it practically glowed. We were taught that the sting meant it was working, that the cleaner the mint, the cleaner the mouth, that if your dentist sold it at the front counter, it must be safe. But the science has moved, and most of the bottles on the shelves at Shoppers Drug Mart, Loblaws, and Walmart Canada haven't moved with it. This investigation is going to walk you through 9 of those bottles, ingredient by ingredient, and then give you 3 alternatives that actually align with what the current research is suggesting your mouth needs. Think about the math for a second. Most Canadians who use mouthwash use it twice a day. That's roughly 730 exposures a year. Multiply that by 20, 30, 40 years of adult use, and you're looking at tens of thousands of contact events between a chemical solution and the soft, permeable tissues that line your cheeks, your gums, the underside of your tongue, and the back of your throat. The oral mucosa isn't skin. It doesn't have that thick, keratinized barrier that protects the rest of your body. It absorbs. It's one of the most efficient delivery surfaces in the entire human anatomy, which is exactly why nitroglycerin tablets for heart patients are placed under the tongue. So when we talk about what's in a mouthwash bottle, we're not talking about a quick rinse and spit. We're talking about a chemical introduction to a tissue system that's actively pulling small molecules into your bloodstream every single time you swish. That changes the calculus. It means the ingredients deck on a mouthwash bottle deserves the same scrutiny you'd give a supplement label or a prescription insert. And right now, most Canadians aren't giving it that scrutiny because nobody ever told them they should. Here's the reframe most people haven't caught up to yet. You've been told mouthwash kills the bacteria that cause bad breath, gum disease, and cavities. What the research has actually been saying for the better part of a decade is that the broad-spectrum antimicrobial action of many conventional mouthwashes doesn't discriminate between the bacteria you want gone and the commensal microbes that actually keep your mouth healthy. The oral microbiome, much like the gut microbiome, is a delicate ecosystem. When you carpet bomb it twice a day with ethanol, chlorhexidine, or cetylpyridinium chloride, you don't just kill the bad guys. You also wipe out the bacteria that produce nitric oxide, that maintain a healthy oral pH, and that act as the first line of defense against opportunistic pathogens. The cleaner you think you're getting, the more disrupted the underlying ecosystem may actually become. So this video is going to do something pretty specific. We're going to look at 9 mouthwash brands sold widely across Canada, and we're going to trace the concerns through their actual ingredient decks, not vibes, not marketing. The chemicals themselves, what Health Canada has said about them, and what independent dental researchers have been publishing. Then we'll show you 3 brands that take a different approach. Before we go any further, if this kind of investigation is the reason you came here, take a second to subscribe so the next one finds you, and drop a comment with the mouthwash you've been using for years. We read every single one, and they often shape what we look into next. Now let's get into it. The first brand on our list is Listerine, which is owned by Johnson & Johnson, and remains the single best-selling mouthwash in Canadian retail. The original Listerine antiseptic, the amber one, contains ethanol at a concentration of roughly 26%. To put that in perspective, that's higher than most wines, and it's being held in your mouth for a full 30 seconds twice a day. The Canadian Dental Association has been progressively cautious about regular daily use of high-alcohol mouthwashes, citing a series of studies that have explored possible links between long-term ethanol exposure of the oral mucosa and an increased risk of certain oral health concerns. Beyond the alcohol, classic Listerine relies on a cocktail of essential oils, including methyl salicylate, which is the wintergreen-derived compound that gives it that distinctive medicinal bite. Methyl salicylate in concentrated form has been associated in clinical literature with potential systemic effects when ingested in larger quantities, which is one of the reasons every bottle carries a keep out of reach of children warning. In plain language, you're swishing a high alcohol solution flavored with a compound chemically related to aspirin twice a day against tissue that absorbs molecules directly into your blood. The verdict on classic amber Listerine, in our opinion, is that the formula is overdue for a rethink. Crest Pro Health is the second one we need to talk about, and it's interesting because Procter & Gamble specifically markets this line as the alcohol-free alternative for people worried about the burn. That's true on the alcohol front. What it isn't is concern-free. The active ingredient in most Crest Pro Health rinses is cetylpyridinium chloride, often abbreviated CPC. CPC is a quaternary ammonium compound, and it does a respectable job killing bacteria in lab settings. The issue that's emerged over years of consumer feedback and dental literature is that CPC at sustained daily concentrations has been linked in some studies to extrinsic tooth staining, a brownish discoloration that builds up along the gum line and between teeth. It's been associated with altered taste perception in a subset of users, sometimes lasting hours after rinsing. And like most broad-spectrum antimicrobials, it doesn't distinguish between pathogenic bacteria and the helpful microbes that maintain your oral ecosystem. Crest Pro Health also typically contains sodium saccharin as a sweetener and blue 1-dye for that signature color. The translation here is straightforward. You're trading the burn of alcohol for the slow accumulation of a different chemical with its own documented downsides. In our opinion, this isn't the upgrade the marketing implies. Scope, also a Procter & Gamble product, is the third bottle worth scrutinizing. Scope built its identity on being the gentler, fresher alternative, but the original mint formulas have historically contained alcohol concentrations between 15 and 19%. Lower than Listerine, sure, but still substantial enough to fall within the range that the Canadian Dental Association has cautioned against for daily long-term use. The flavor system relies heavily on artificial sweeteners and green 3 or blue 1 dyes, depending on the variant. And Health Canada's cosmetic ingredient hot list has tracked synthetic colorants for years as a category warranting regulatory attention. Green 3, in particular, has been the subject of ongoing review in multiple jurisdictions. The added concern with Scope is the brand positioning. Because it markets itself as the friendly, less aggressive option, many Canadian families have used it for decades, under the impression that it's somehow safer than the traditional antiseptic mouthwashes. The ingredient deck doesn't fully support that impression. In our opinion, Scope deserves a second look from anyone who's been treating it as the gentle choice. Colgate Total Mouthwash is the fourth on this list, and it's a brand that benefits from enormous trust equity built over generations. The mouthwash formulations under this line vary, but the most common Canadian retail versions include cetylpyridinium chloride as the active antimicrobial paired with sodium saccharin, propylene glycol, and synthetic dyes, including blue 1 in several variants. The same concerns we raised with Crest Pro Health around CPC apply here, including the staining potential and the broad antimicrobial action against the oral microbiome. Sodium saccharin has been on regulatory watch lists for decades. Health Canada permits its use within established limits, but a growing segment of dental researchers and integrative practitioners argue that introducing a synthetic sweetener to the oral cavity twice daily may have downstream effects on the very bacteria you're trying to manage. Sweet-tasting compounds, even non-caloric ones, have been studied for their influence on oral bacterial behavior. The translation is that Colgate Total Mouthwash, despite its premium positioning, sits squarely in the conventional formula category. In our opinion, the trust the brand has earned isn't currently matched by ingredient innovation. Plax, made by Colgate-Palmolive, is the fifth brand we need to address. Plax is marketed as a pre-brushing rinse designed to loosen plaque before you brush, which sounds clever in the commercial, but matters less when you read the deck. Plax formulations have historically included sodium benzoate, sodium lauryl sulfate, or related surfactants, alcohol in some variants, sodium saccharin, and artificial colorants. Sodium lauryl sulfate is the same foaming agent that's drawn criticism for years in toothpaste formulations, with multiple studies associating it with a higher incidence of canker sores in susceptible individuals. The combination of a surfactant designed to disrupt biofilms with a sweetener and a synthetic dye, all held in the mouth before the actual brushing happens, is a lot of chemistry to introduce to soft tissue twice a day. Health Canada permits these ingredients within concentration limits, but the cumulative exposure question is one this video keeps returning to. In our opinion, Plax represents a category of product where the marketing innovation outpaced the formula innovation. ACT, which is widely sold across Canadian pharmacy chains, is the sixth brand that requires careful examination. ACT positions itself as a fluoride rinse for cavity prevention, and the fluoride argument is one we'll address fairly. Sodium fluoride at controlled concentrations has documented benefits for enamel remineralization, and Health Canada, along with the Canadian Dental Association, continue to support its use in dental products. The concern with ACT isn't the fluoride, it's the carrier system. Many ACT variants contain alcohol in the 8 to 11% range, sodium saccharin, and synthetic dyes including blue 1 and green 3. So what you've got is a useful active ingredient delivered in a vehicle that brings along several of the very compounds this investigation has been flagging. The artificial mint flavor in ACT is one of the more aggressive on the market, and the blue or green color is intense enough that long-term users have reported staining on white porcelain sinks over time. That's a small thing, but it's a sensory clue. If a liquid stains your sink, ask what it might be doing to the tissues it's actually designed to contact. In our opinion, the fluoride benefit doesn't fully offset the carrier concerns. TheraBreath, now owned by Procter & Gamble after the acquisition, that closed within the last few years, is the seventh on our list, and this one comes with nuance. The original TheraBreath formulations, developed by Dr. Harold Katz, were specifically designed for people with chronic halitosis and used oxygenating compounds rather than traditional antimicrobials. That foundation was genuinely innovative. The concern that's emerged since the acquisition is the gradual reformulation that's affected portions of the product line, with some variants now incorporating sodium saccharin, artificial flavors, and in certain Canadian retail lines, synthetic colorants. The brand still positions itself as the dentist-developed option for bad breath, and for users who stick to the original purified formulas, that case can still be made. But the variants showing up at Walmart Canada and Shoppers Drug Mart aren't always the original formulas. The bottle on the shelf today may not be the bottle the brand built its reputation on a decade ago. In our opinion, TheraBreath buyers need to read the deck on every individual variant, rather than trusting the brand name alone. Hello, the brand that built its identity around friendlier oral care, is the eighth one we need to discuss, and we want to be fair about this. Hello has done meaningful work removing alcohol, artificial sweeteners, and synthetic dyes from many of their formulations, and on those fronts, they're a step ahead of most of the conventional players we've covered. The reason they make this list is that several Hello mouthwash variants still rely on flavor systems and preservatives that the cleaner end of the market has moved past. The brand also uses cetylpyridinium chloride in some formulas, which brings us right back to the staining and microbiome concerns we covered earlier. The packaging is bright, the marketing is warm, and the brand voice is genuinely appealing, which makes it easy to assume the formula is fully aligned with the friendly positioning. The deck doesn't always confirm that assumption variant by variant. In our opinion, Hello is closer to the safer end of the spectrum than the rest of this list, but it isn't yet a clean recommendation across its full range. Tom's of Maine, our ninth and final brand on the avoid list, is going to surprise some viewers, and it deserves the most care. Tom's built its reputation on natural ingredients and transparent labeling. And for many Canadians, it's been the trusted alternative to the mainstream players for years. We're including it here because the brand was acquired by Colgate-Palmolive, and in the years since that acquisition, certain mouthwash formulations have included ingredients that wouldn't have appeared in the original Tom's catalog. We've seen variants on Canadian shelves that include propylene glycol, synthetic-derived flavor compounds, and in some formulations, sweeteners that the early Tom's customer base specifically avoided. The brand still does many things well. The alcohol-free positioning is genuine across most of the line. But the assumption that any product with the Toms of Maine label on it is automatically aligned with the natural product's ethos no longer holds the way it did 15 years ago. In our opinion, Toms of Maine requires the same variant-by-variant scrutiny we'd recommend for any conventional brand. Quick pause. If this investigation is the kind of work you want more of, hit subscribe and turn on the bell so the next deep dive lands in your feed. Drop a comment with which of these 9 surprised you the most. We genuinely read them. Now, I want to circle back to the worst offender on this list because it deserves a longer look. Classic amber listerine at 26% ethanol is, in our considered opinion based on the available evidence, the formulation on Canadian shelves that warrants the most caution for daily long-term use. Here's why this one rises above the others. The combination of high ethanol concentration with methyl salicylate and the essential oil cocktail creates a sensory experience that many users have been culturally trained to interpret as effectiveness. The burn is the sales pitch. That burn is the alcohol stripping the lipid bilayer of bacterial cell walls. Yes, but it's also doing the same thing to the cells lining your mouth. The Canadian Dental Association's evolving position on alcohol-based mouthwashes has been a slow, measured walk away from blanket endorsement and toward a more nuanced position that acknowledges the research linking long-term high alcohol oral exposure to a range of oral health concerns. Within the last 12 to 24 months, ongoing peer-reviewed work continues. To add to a body of literature on how ethanol-based oral rinses interact with the oral microbiome, with several studies suggesting that twice-daily use measurably reduces beneficial bacterial populations alongside the pathogenic ones. The methyl salicylate component compounds the concern because it's a compound your body absorbs, processes, and metabolizes, and the cumulative load over years of daily use isn't trivial. I'll be honest, I used the original amber listerine for years in my 20s. I thought the burn meant it was doing something my brushing wasn't. The first time I switched to a non-alcohol alternative, my mouth felt strange for about a week. It felt too quiet, too soft. And then I realized that what I'd been calling clean was actually irritation. That subtle inflammation was so constant, I'd stopped noticing it. The translation is that the sensation many of us have associated with effective mouthwash is, in many cases, the sensation of mild chemical injury we've adapted to. In our opinion, classic amber listerine is the bottle on this list that most clearly deserves a hard look from anyone using it daily. Before we move into the safer alternatives, let's take a breath and acknowledge something important. Mouthwash isn't all bad, and there are clinical situations where a prescription-strength antimicrobial rinse, including chlorhexidine gluconate, is genuinely warranted. Patients recovering from periodontal surgery, individuals managing aggressive gum disease, chemotherapy patients dealing with oral mucositis, and postoperative dental patients all have specific clinical needs, where short-term targeted use of a strong antimicrobial rinse, prescribed and monitored by a dentist or physician, can be the right call. The concerns this video has raised aren't about those clinical contexts. They're about the assumption that a daily over-the-counter mouthwash is a benign addition to a healthy adult's routine. Those are different questions. If your dentist has prescribed a specific rinse for a specific condition for a specific duration, that's a conversation between you and your dental professional, and nothing in this investigation should override that guidance. What we're addressing is the bottle of conventional mouthwash that's been sitting on your bathroom counter for years, used twice a day by default, with no specific clinical indication driving the habit. So what does the safer end of the mouthwash spectrum actually look like in Canada? Let's get into the 3 brands worth your attention. Closest is the first one we want to talk about. The brand is built around a stabilized chlorine dioxide formula that takes a fundamentally different approach to oral hygiene. Instead of broad-spectrum antimicrobials, the active mechanism focuses on neutralizing the volatile sulfur compounds that cause bad breath at the chemical level. The standard closest formula is alcohol-free, sulfate-free, gluten-free, and the unflavored version contains no artificial dyes or sweeteners. There's a flavored version available for those who want a mint experience, and the mint flavor in Closest is notably milder than the aggressive synthetic mint of conventional brands. The first time you try it, the experience is almost startling. There's no burn, No chemical bite. No bright color. It feels almost like rinsing with water that happens to be doing something useful. Close IS is available through select Canadian pharmacies, online Canadian retailers, and some dental offices. The brand has built credibility through dental professional recommendations rather than mass market advertising, and the formulation reflects a different philosophy about what oral hygiene should feel like. In our opinion, Closis represents one of the cleanest mainstream accessible options available to Canadian consumers right now. The second brand worth considering is Lucky Teeth, a Canadian-friendly natural oral care line that's been gaining traction in the cleaner end of market segment. Lucky Teeth offers oil-based and herbal-based oral care products that take a fundamentally different approach to mouth care, drawing on traditional ingredients like coconut oil, essential herbs, and plant-derived compounds rather than synthetic antimicrobials. The brand is transparent about every ingredient on the label, doesn't use artificial dyes or sweeteners, and avoids the alcohol and CPC formulations that dominate the conventional market. Lucky Teeth isn't going to give you the dramatic chemical sensation that decades of mouthwash advertising has trained us to expect. What it offers instead is a gentler approach that works with the oral microbiome rather than against it. The brand is available through Canadian natural products retailers, online directly, and through select health-focused storefronts. For viewers looking to step outside the conventional mouthwash paradigm entirely, this is one of the options that deserves serious consideration. In our opinion, Lucky Teeth is doing something genuinely different in a market that's been stagnant for too long. The third brand we want to highlight is Living Libations, which approaches oral care through a botanical and essential oil framework. Their oral care offerings, including their well-known oral serum, use food-grade plant extracts and essential oils in concentrations designed for safe oral use. There's no alcohol, no synthetic dyes, no artificial sweeteners, no synthetic preservatives. The brand is small batch and premium priced, and we want to be transparent that this isn't the most accessible option for every budget. But for viewers who've decided they want to fundamentally rethink what's going into their mouth twice a day, Living Libations represents one of the most thoughtfully constructed natural oral care lines available to Canadian consumers. The products are sold through Canadian natural health retailers, online directly, and through specialty wellness storefronts. The ingredient transparency is among the highest in the category. In our opinion, Living Libations sits at the premium end of the safer mouthwash spectrum, and for those who can fit it into their budget, it earns its place there. Now let's talk about how to read a mouthwash label so you can make these calls yourself, regardless of what brands end up on shelves a year from now. The first thing to look at is the alcohol or ethanol content, which will be listed either as a percentage on the front of the bottle or in the ingredients deck. Anything above 5 or 6% ethanol is in the territory the Canadian Dental Association has been increasingly cautious about for daily long-term use. Many conventional brands sit between 15 and 26%. The second thing to check is the active ingredients section, typically called out separately from the inactive ingredients. This is where you'll find chlorhexidine gluconate, cetylpyridinium chloride, sodium fluoride, or other compounds doing the primary work. If you see chlorhexidine gluconate in an over-the-counter product, ask whether you actually need a clinical-strength antimicrobial for daily use, because the answer for most healthy adults is no. If you see cetylpyridinium chloride, weigh that against the staining and microbiome considerations we discussed. The third thing to scan for is artificial colorants, typically listed as blue 1, blue 2, green 3, yellow 5, or similar codes. Health Canada's cosmetic ingredient hot list has tracked synthetic dyes for years as a category that warrants ongoing regulatory attention, and there's no functional reason for a mouthwash to be brightly colored beyond aesthetics. The fourth thing to check is the sweetener system. Sodium saccharin, aspartame, sucralose, and acesulfame potassium are common in conventional mouthwashes, and while Health Canada permits their use within established limits, the cumulative exposure question for twice daily use over decades is one the regulatory framework wasn't originally built to address. Cleaner formulations either skip sweeteners entirely or use small amounts of natural alternatives. The fifth thing to look for is the carrier and preservative system, which includes ingredients like propylene glycol, sodium benzoate, and various parabens. None of these are inherently alarming in isolated exposure, but the cumulative load across all your personal care products adds up, and a mouthwash you use twice a day is a meaningful contributor. If you take nothing else from this video, take this. The bottle of mouthwash you've been using on autopilot deserves the same careful read you'd give a supplement label. The Canadian Dental Association's evolving position on alcohol-based mouthwashes, the Health Canada, cosmetic ingredient, Hot List's ongoing scrutiny of synthetic dyes, and the steady accumulation of peer-reviewed research on the oral microbiome all point in the same direction. The conventional mouthwash paradigm we grew up with is overdue for a rethink, and the cleaner alternatives we covered, Closis, Lucky Teeth, and Living Libations, represent the direction the more thoughtful end of the market is moving. You don't have to throw out everything in your bathroom tomorrow. You don't have to become a different person about oral care. What you do have to do is make a deliberate, informed choice instead of a default one. Read the label. Ask whether the ingredients align with what you now know. Talk to your dentist about whether your daily mouthwash use is actually serving a clinical purpose or whether it's a habit you inherited from a half-century of advertising. And if you've been using a high-alcohol amber rinse for years, consider whether the burn you've been calling clean might be worth replacing with something that works with your mouth instead of against it. Right now, before this video ends, walk to your bathroom, pick up your mouthwash bottle, and read the alcohol percentage on the front and the active ingredients on the back. That single act, taking 30 seconds to actually look at what you've been swishing twice a day, is the beginning of every better choice you'll make from here forward.